Բարի երեկո սիրելի բարեկամներ։ Այսօրվա մեր հայդակիրն է բժշկական հայդակիրը, որ կապված է յուրոլոգիստի հետ եւ յուրոլոգիստի հատկապես տարբեր գործողությամբ, որ այսօր մեր հյուրը Dr. John Kowalczykը պիտի փաստացի։ Welcome, doctor. How are you?
I'm good. Thank you for having me tonight.
Sure. A little bit background. You're a urologist by training?
I am a board-certified urologist, actually born and raised in Chicago. I did my fellowship training at Indiana University and took my first job here in California.
So you've been a long-time California resident.
I have.
And tell us a little bit about the urology field nowadays. I mean, it's been a long time since you graduated and did your fellowship.
So the challenges that have occurred in urology have actually started to have new prospects in terms of treatments. Historically, even before when I was a resident, we had very little options in terms of treating people, especially with urinary incontinence. Most of the time it was just a diaper. Some of the early medications, which are still prescribed today, have a lot of side effects, including dry mouth, constipation, and now the FDA has placed a warning on the medication for our senior patients. It can actually make the dementia or memory worse as they're getting older using the medications. So we needed to look for other options along the way. There were some what we call neuromodulators that were developed several years in the past. However, the problem with those are there's like the pacemaker that they put in for the heart. The batteries die, and you need to have another surgery to replace that.
To replace the battery.
Absolutely. Okay. So now you're getting older, and now you're having more problems otherwise health-wise, and you need another surgery. So these create risk factors every time you go under anesthesia. One of the companies that have recently developed a newer technology that allows us to help control the leakage issues and the frequency and urgency is called Exonics. And they've developed a modulator that basically is much smaller. And the most important thing about this, the revolutionary component, it's rechargeable. The person who now has the device, could be male or female, will sit like we are in a chair right now, maybe having a conversation. Maybe if it's a person who has a knitting hobby or reading hobby, they could sit, read. They're charging their device once a week, probably no more than that. And now they're able to go out in life and basically continue to live
normal life.
Yeah. They could go visit their grandkids and not worry about wetting the sofa or wetting the bed. They can spend the weekend instead of saying, no, I have to go home.
So this is something recently that's been developed by the company?
It has. Actually, the first implant that was done commercially was done, I think, was it in November of last year?
So very recent.
Yeah, and it happened to be here in the greater Los Angeles area, and it was done at the Avalon Surgical Center, and we were the first ones to implant it commercially.
And we have the rep from the company.
We have the rep here today, Netty.
This is the best time, I think, to introduce her. So this is very revolutionary idea, right? Your company come up with?
So the nice thing about the therapy is it's tried and true. The therapy in itself has been around for 22 years, but unfortunately it just had not been revolutionized. And that's what we did. We came in and we innovated the technology to make it patient-friendly. So the device, it's really small. It's about the size of a thumb drive. It's shown there.
You're going to show it to the
Let me
audience?
Yeah. So this is it. This is the tiny little device that actually goes placed about 2 centimeters under the patient's skin. It's indicated to last at least 15 years, which means, no more surgeries constantly to have the battery replaced. In addition to that, it's MRI safe, which is a huge deal for especially our elderly population, but really almost anyone. It's very common that people nowadays have MRIs even just for sports injuries. So for the younger population as well. So this is completely safe in order to have an MRI. In addition to that, the components are wireless. We wanted to make them sleek and then also very discreet. So this is their patient remote control. It's not something that they have to use, but they have it available if they'd like to in order to increase their stimulation, decrease their stimulation. But it's sleek, it's small. There's no reason anymore for somebody to know that the person has incontinence. We really have made it so that it's something that is not going to hinder the patient's life and is really just going to allow them to live their lives freely.
Like a normal life, yeah. And this was just developed in November, and the first doc you said
Well, it was released. We had the FDA approval to actually implant the device, and we were on standby waiting for the final approval before we were able to do it. We had a patient that was ready to go, and as soon as the FDA approved it, we immediately got that patient into the operating room. And it's the great thing about this, it doesn't require the patient to go under a deep anesthesia. They could be under a sedation.
Local, yeah.
Well, local or with some sedation so that they are not completely having to worry about the effects of not breathing during the procedure. They're laying flat on their stomach while the procedure is being done. It's basically done with 2 small needles, and it's in the low part of the spine we call the sacrum, so near the buttocks. Once the needles are placed, 2 very fine wires are then inserted. The incision, when you actually look at the device, is only this small, about 1 inch to 1.5 inches.
1.5 inches, yeah.
Once the device is put in there, it's a few skin sutures, just like as if you had a cut or biopsy done, and you go home the same day.
Same day. And now, since you've done it, any feedback from patients?
We actually have significant feedback that's coming back. We just did what we call a test in the office at the surgery center. You do these in the office, or you do it under a local at any facility that's able to do that. We had a woman that came in, and this was just the other day. We put in the stimulator. She was having a lot of urgency and leaking constantly. By the time we got her back into the recovery room, and she was getting ready to go home, she was already in tears, basically telling us that, oh my God, I'm not leaking. I'm standing up, I'm not leaking. That's how fast it worked.
The result is instantly.
Correct.
Let's talk about the pricing. Is it something covered by Medicare?
Yes, so Medicare fully covers it. And as a matter of fact, almost all payers will cover this procedure, the majority of them. And so it's nice because it's something that the insurances are recognizing that really helps patients, and they're willing to cover it.
Mm-hmm. And surgically, you're saying within, less than half hour to do the whole thing, A to Z?
It could be anywhere from as little as a half hour to sometimes as much as an hour. It depends also on when we're doing the procedure, they're actually doing some test programming. So you want to make sure when you're putting the final wires in place that they're in the perfect location. And the reason we do all that at the beginning before we make any incisions, just with the needles, is because you want to make sure you're right in the right place.
Right.
And then once you deploy or release the wire in there and you remove the needle, they have these little graspers under the skin that keep it in place so it doesn't move around.
And have you done any studies to show the long-term effect?
Absolutely. So even though we've only recently commercialized in November of last year, our clinical studies, we have one that goes out to 3 years, another one that's currently at the 2-year mark, and the results are phenomenal. So patients have an average efficacy rate of 90%. So 90% of the patients that were in our study were test responders. And what we mean by a test responder is they had at least a 50% reduction in their symptoms. The majority of our patients actually have a much greater reduction, but we define success in the study as 50%, so 90% of the patients.
Okay, we're going to take a break. When we come back, we'll discuss about some of the other issues with the doctor. Սիրելի պայգամներ, գազ սաթարմը բիդանեք և բիդի վերարտանակ մեր հայդակրին։
Ավալոն վիրաբուժական կենտրոնն առաջարկում է նոր հեղափոխական բուժման միջոց անմիզապահության համար։ Axonix ընկերության այս նորագույն իմպլանտը թույլ է տալիս եւ տղամարդկանց եւ կանանց վերահսկել միզապարկը եւ մեկընդմիշտ ազատվել հաճախամիզությունից։ Ավալոն վիրաբուժական կենտրոնը բացառիկ հնարավորություն է տալիս նախքան վիրահատությունը փորձել այս իմպլանտը։ Արդյունքը երևում է անմիջապես։ Փորձարկումից հետո այցելուների մեծամասնությունն անցնում է մշտական իմպլանտի, որովհետև այս նորագույն միջոցն ամբողջովին գոհացնում է պացիենտների ավելի քան 90%-ին։ Axonix-ը մինչև այսօր գոյություն ունեցող իմպլանտներից ամենափոքրն է եւ այն վերջապես թույլ կտա խորը շունչ քաշել եւ լիարժեք վերահսկել ձեր կյանքը։ Ավալոն վիրաբուժական կենտրոնում ընդունվում են բոլոր ապահովագրությունները, այդ թվում Medical, Medicare եւ Elecare։
Սեր պայգամներ, այսօրվա մեր հյուրերն են urologist-ը եւ դինը որ medical device company-ն է. You were saying surgically is fairly quick as opposed to some of the older types of surgeries that was, hours and so forth.
Absolutely. Early on, when they first developed the earlier version from another company, the process could take over 2 hours to actually install.
Install it.
If you were the patient and you were trying to do this under a local or with sedation, it became extremely uncomfortable and difficult for the person to tolerate. So the ease of inserting this nowadays, the sleekness of the actual devices that keep everything minimal in terms of making incisions, and the tubes that are used to go under the skin make it so finesse. The finesse is so easy now that you're able to get the devices in there with little or no.
And it could be done in a surgical center, and the patient can go home same day.
Absolutely. With the recovery afterwards in the recovery room is usually less than an hour. So think about it. Just an hour after you've done, you get to go home.
And you were telling just before the break that the results is instantly, people feel it right at the spot or right after the surgery.
Yeah, so as soon as the patient comes out of the procedure room, we turn it on and instantly they'll be able to feel something.
Feel it, yeah.
It's actually a feeling that they get used to. So a lot of people think, oh, what is it going to feel? Is it going to be a constant, tingling sensation? You get accustomed to it. The patients actually learn to love it. A lot of them don't mind the sensation, and the fact that they know that sensation is the reason that they're not leaking anymore. That's what makes them love it. It's almost like a security
They become
blanket.
a normal person again.
Exactly.
In there. Could help also some other aspect you were saying?
Yes, so not only can it help with urinary incontinence, it can help with urinary retention. In addition to urinary retention and urinary frequency, it also helps with fecal incontinence. This is a terrible diagnosis that people live with, and a lot of times they don't admit it, not even to their doctors, because they're so embarrassed. But the same procedure can help the patient who is leaking urine as well as has fecal incontinence.
So it has a pretty much round, benefit. What's the total cost of having this procedure? People ask that question, but you said Medicare will cover that, but just in general.
So typically, the actual device in itself, it's not cheap. It's you're looking at somewhere around $17,000. But again, the insurance, we've proven to insurance that this works so well for patients and that they really end up saving money in the long run because they don't have to pay for medication and diapers and
all that will go away, yeah.
Yeah, exactly. And so that's why insurance is covered. So most often, patients walk out of there with little to no bill.
From a medical standpoint, even though they've done some studies, still relatively new, right? To implement something like this on the patients and the feedback you will get from the patients as they leave.
That's a good question, and the answer actually is the technology that they're using is relatively new for two purposes. One is more from the physics standpoint, using a different, instead of using voltage, they're using current. And that changes, that's a game changer in itself, again, from that standpoint. But the most important part is the fact that it's rechargeable. In terms of the actual technology, it's been around for over 20 years.
Yeah, that's what.
And the very first ones, as I said, were fraught with lots of difficulties. You can't, the original ones, you cannot have an MRI. So if you had some sort of problem that required, for example, you wanted a hip surgery and you needed an MRI, you can't get it done.
Whereas this one, you can have MRI.
Very safe, very safe.
Very safer. What's some of the newer things in urology? Since overall you're a urologist.
So I like to tell, I have students that come with me every time, and what I like to tell them is when I was a resident, one of the things we had to do, even our diagnostic studies required you to come in the night before surgery, and we would admit you into the hospital, and you have to get a whole checkup and have to undergo general anesthesia. You had complications because the devices were older. As technology is moving along forward, we are now able to do almost all of our diagnostic studies, including the things we used to do in the hospital, now in the office, in minutes, in 15 minutes. We could come up with our game plan. The actual test for this procedure can be done in the office. So if a person just had one transportation issue, and they could only get to your office, they couldn't get to another place like a surgical center right away, we can actually do it in the office in a regular exam room for the testing. So the technology for this, the technology for our diagnostics, and we even have newer technologies for prostate treatment. Historically, people had to undergo surgery we call transurethral resection of the prostate.
Cutting it, the whole thing.
Exactly. Leaving you with the possibility of impotence, incontinence as a side effect. Now we actually have newer devices that actually allow you to clip the prostate down. And that is something also that can be done in the office setting. Again, no general anesthesia, very little side effects. So I would have to say that the companies that are developing the devices for us are actually developing devices that allow the urologist to be more friendly to our patients by not scaring them or putting them at risk for general anesthesia.
Yeah. So a lot of these procedures are done under local or sedation,
Correct,
as opposed to general anesthesia and so forth. And that's a huge benefit to the elderly patient.
Exactly.
And any new devices in the horizon, since this is such
so-
a revolutionary idea?
Yeah, so one of the cool things about the company Axonics is that they only focus on sacral neuromodulation. And so they're constantly developing the second generation device is already being tested and is about to be submitted to the FDA. So we're solely focused on improving this technology and making it as good as we can for our patients.
So can we have a peek? What is that next generation is going to look like?
Certainly. So one of the things that I can tell you is that the device, the next generation, will be actually even smaller than this. The recharge intervals, which is essentially the amount of time between charges, that's going to be even longer. So right now, for example, you have to charge typically every 2 weeks for about 30 minutes, so about twice a month. We're going to extend that, and it's going to be about a month. These are huge advances in the technology, and better for the patient.
The cost is going to be higher than 17,000 or similar?
The cost is going to be the same. We want to make sure that we're allowing our patients to have this device, and the last thing that we would want for it to get in the way would be cost. And so same thing as our competitor, even though our device is far superior from a technological standpoint, our prices are the same or a lot of times even less expensive than theirs.
That's amazing. So that is, so much changes is happening with the technology and how these various devices are being improved. So we're going to take a break. When we come back, we'll continue our discussion. Սեր պայգամներ, գարսաթալմը վիդանեք և բիդի վրատանակ մեր հայդակրին. Սեր պայգամներ, այսօրվա մեր հյուրերը կխոսին յուրոլոգիստի մասին և յուրոլոգի վերջին նորության մասին. Really, this has improved the quality of life of someone who's been on this continuous vicious cycle, so to speak. All of a sudden, all that stops, and it's a better quality of life, right?
There's no question. Picture this. Your grandmother, who's having some incontinence, loves and adores your kids, and she's afraid to come visit you. It might be a holiday, Christmas or Thanksgiving or something else. The reason why she doesn't want to come visit you is because she's afraid that she might leave a spot on your sofa, that she doesn't realize the fact that there are other options. She'd been on medication before, but she had serious side effects. So she's isolating herself, not just from family, but also her friends and neighbors. So now grandma's living in isolation. Picture now having the implant, and all of a sudden you're inviting grandma back to the holidays. She now has the grandkids sitting next to her without any fear. She doesn't have to worry about making a stain or any kind of odor in your house.
Plus, I mean, it is a permanent solution as opposed to getting medication and the side effect of medication, and you do the procedure, you're done basically, right?
Absolutely. And the other thing, with medication, you have to keep coming back to the doctor's office to get a prescription. Once you're done with this, you just come back to see us at the time when you have to have a little checkup. Maybe you have a question whether or not it's working. You come in, we have the representatives come. They have a very simple process at checking how the device is working. It's almost Star Trek technology.
That's really revolutionizing the way the urology thing is being conducted.
It is.
Definitely. As far as the device itself, you said new generations are coming. Anything else in the horizon that gonna completely change besides this device? You can give us some peek.
Well, one of the things is that we wanted to make sure that the patients who have the existing therapy are also going to have the option without having to undergo a full explant. The majority of our patients opt to have their old systems taken out and the new axonic system.
Oh, so that's the newer thing,
placed,
because
yes.
people had the older procedures, so you're just replacing them.
But one thing that the company, again, has in the works and will hopefully be released soon is that our generator will actually be compatible with their lead, which will mean that now, in order to have the axonic system, it's a 5-minute procedure. So all they do is swap out the
change
battery.
it, yeah.
And that could be done under local anesthesia.
Wow. So that is a really an advances. How long you been practicing urology?
I've been practicing urology for
Just a
25
curiosity on my
years.
part,
Yeah,
your training.
25 years. I actually started medical school before I was 20, and I was able to start my practice 25 years ago.
And you've been in our community in Glendale, right? All
I
these
have.
years.
I have.
Some of the other urological issues that people come to you besides incontinence issues.
We see people for a variety of urologic issues, anywhere from as simple as having a recurrent urinary tract infection to kidney stones, prostate issues, erection issues for men, and of course incontinence issues for both men and women. So this is not just a device for women, this is for men and women.
Both to have that procedures done. Any advice to someone having any incontinence? Don't be afraid, just call you.
Absolutely, and this is important because
Not the fear, because people have the fear to go and...
It's embarrassment.
Embarrassment,
So
exactly,
don't
that's
be
the right word.
Don't be embarrassed. Now with the technologies that are out there, we're able to offer you treatments that you wouldn't have had before. These options now create a scenario where you can actually come in, and in majority of cases, we'll be able to find a solution for you. There's still areas we can't fix, but the majority of the time, we can come up with a working solution.
So you can pretty much, the majority or 90-95% of the population that is in this situation can be cured, can
Absolutely.
be, have a good outcome, so to speak. Any final thoughts?
I have a story I'd like to share.
Sure,
So
definitely.
during the clinical study, I've been with the company for almost 4 years. So I was part of the very small team that ran the clinical trials. And so I had a patient, 24 years old, 2 kids. She had never been able to go on vacation with her children because she had such severe leaking episodes that she just couldn't. And so from the day we implanted her until 6 months out, she was completely dry. And that gave her the courage to actually drive her kids from San Francisco all the way to Legoland on her first vacation ever. And as this patient's telling me the story, she's literally coming to tears. And I'm happy to report that now she's at the 2-year mark and she has not had one episode of urinary leakage since the day she had her implant placed.
Of course, stories like that, they just lift your
That's
spirits.
really what makes it worth it.
Yeah, of course, it's definitely. Any other thoughts, Doc, you can add to? I mean, the wonderful discussion we had, and a wonderful outcome of these treatments. It's just you're revolutionizing the way urology and medicine is being conducted.
Absolutely. And historically, people were afraid to come see the urologist. As a matter of fact, the joke basically was, if you're coming to see us, you must have either a cancer or you're having a major issue where you're not able to control your urine. And the technology now allows us not just to go for the extreme cases, but people who are starting to have mild to moderate symptoms. We could actually put them in a regimen of treatment, whether it be as simple as a medication or as advanced as technology as this. And we can actually do things like this that allow them to get back into normal life. For example, if a male is having incontinence, and they may have not just had the incontinence, but also erection problems or embarrassment to have sexual intercourse because they would leak. Now you've actually created a new situation where if this was a single male who was lonely, it gets the urinary control, he's now able to go and pursue a companionship and maybe even get remarried if that's the case.
Yeah, because it changes people's, lifestyle.
Exactly, and that's the whole thing, is we want to improve your lifestyle the best we can, and that's what urology is offering. It's in all areas of our treatment regimens.
So our advice to our audience, if you're facing these issues, don't be embarrassed, first of all.
Don't be embarrassed.
Seek treatments, and the treatments and the outcomes are fantastic. I mean, there's good outcomes.
The outcomes are wonderful in comparison to what we had to offer before.
And it's nothing major surgeries that you have to go into general anesthesia and so forth. So
Not at
just
all.
a minor procedure can be done in a surgical center or doctor's office.
The way I described the test, I said if you've ever had acupuncture, it's nothing more than acupuncture for the original test when we're putting in the needles.
Well, needles, okay. Any final thoughts?
I would just encourage people to be brave, be your own advocate. That is my number one thing I tell patients is you need to stand up for yourself, and the second you take the first step of calling us, we'll be there to guide you the entire way, and we'll help you, and we'll hold your hand through it. That's
Because
what
the
we're
biggest
here
thing
for.
people or patients have is the fear.
Exactly.
You know? Fear, oh my God, this is the worst, you know. Should I
and-
go see a doctor? I shouldn't, you know, it can be the outcome. So you're saying, don't be afraid.
Don't
Take
be
that first
afraid,
step.
be your own advocate. And a lot of people say, oh, it's a normal part of aging. It isn't. This is not something that anyone should have to live with, whether they're
Yeah, this person was 24.
19 or 90.
Yeah. Right, it's not part of aging, basically.
Exactly.
It's a disease that's need to be treated. Any final thoughts, Doc?
The community in Glendale especially, letting them know that there are so many urologists in that area. We are more than happy to help them out in any manner, shape, or form that we can.
And you're collaborating with the other urologists in the area regarding?
We're such a small group of people that we have a unique collaboration, and not with this particular issue. Not all of us are trained to work on using the robot. So we will collaborate with our colleagues and we'll say, hey, look, we're going to try and get approval with our insurance. I have a patient who needs robotic surgery. Can I send them to you? So we try
And vice
and
versa,
keep,
yeah.
Absolutely. We try and keep ourselves friendly, and we work together and we help each other out.
Well, that's wonderful. We're almost at the end of our show. I want to thank both of you to be on this show and explaining, I mean, something really unique. And I had no idea, even though I'm in the medical field myself, about this latest advances. And I want to thank you for explaining to our audience. Thank you so much.
Thank you for
so
inviting
much for
us.
having us.
Of course. Սիրելի բարեկամներ, գպագենք մեր հայդակիրը եւ շնորհակալություն գայտնեմ մեր հյուրերուն այսօրվա շատ հետաքրքիր շոուին համար։ Գիշեր բարի։
Ավալոն վիրաբուժական կենտրոնն առաջարկում է նոր հեղափոխական բուժման միջոց անմիզապահության համար։ Axonix ընկերության այս նորագույն իմպլանտը թույլ է տալիս եւ տղամարդկանց եւ կանանց վերահասկել միզապարկը եւ մեկընդմիշտ ազատվել հաճախամիզությունից։ Ավալոն վիրաբուժական կենտրոնը բացառիկ հնարավորություն է տալիս նախքան վիրահատությունը փորձել այս իմպլանտը։ Արդյունքը երևում է անմիջապես։ Փորձարկումից հետո այցելուների մեծամասնությունն անցնում է մշտական իմպլանտի, որովհետև այս նորագույն միջոցն ամբողջովին գոհացնում է պացիենտների ավելի քան 90%-ին։ Axonix-ը մինչև այսօր գոյություն ունեցող իմպլանտներից ամենափոքրն է եւ այն վերջապես թույլ կտա խորը շունչ քաշել եւ լիարժեք վերահսկել ձեր կյանքը։ Ավալոն վիրաբուժական կենտրոնում ընդունվում են բոլոր ապահովագրությունները, այդ թվում Medical, Medicare եւ Elecare։